Hi, my name is Dennis Wagner. I'm the Director of the Quality Improvement and Innovation Group here at the Centers for Medicare and Medicaid Services.
Hi, I'm Janine Iwugo, Deputy Director for the Quality Improvement and Innovation Group.
So we're now 3 years into the 5-year program of work for the QIO 11th scope. And I want to say that as the director of the QIO program, I am pleased with the results that we're seeing really across the board for all of the tasks associated with 11th scope. We're seeing national progress on the reduction of adverse drug events, including opioids, which are one of the top priorities of our current work to improve healthcare across the country. We're seeing increases in immunizations for frail elderly seniors. We're seeing increases in behavioral health screening, as well as improvements in our nursing home work, which I know you're going to speak to in just a few minutes. Our work to reduce unnecessary hospital admissions and readmissions and more. So it really is shaping up to be a results-focused and a results-delivering 11th scope of work for the QIO program. I'd mentioned earlier the work to reduce unnecessary hospitalizations. So the way that's unfolding in the QIO 11th, and it's very encouraging. Quality improvement organizations are working with more than 400 community coalitions across the nation. They're supporting those coalitions, which are made up of providers from nursing homes, from hospitals, from clinical practices, from pharmacies, and they're working to reduce unnecessary hospital admissions and readmissions. You know, patients, folks like you and I, would rather spend the night at home than in the hospital. And there are a lot of things, it turns out, that communities and healthcare providers can do to prevent unnecessary admissions and to prevent unnecessary readmissions. And in the QIO 11th scope of work, these 400 communities have already saved over $2.3 billion as a result of the unnecessary hospitalizations that they've helped to prevent in those 400 communities. And what that stacks up to is a return on investment. For every dollar that we spend on this work, it turns out that we're saving more than $5 for the Medicare program. And patients are better off for it because patients would rather be at home with conditions that can be treated effectively in a home environment and not in a hospital environment.
Now, our nursing home work has also been tremendous. We've recruited over 12,000 of the nation's 15,000 nursing homes, which is over 78% of the Medicare certified nursing homes. Our goal was 75%, so we've exceeded that goal. We also have begun work to establish a baseline for colostrum difficile infections, which also is a tremendous stride. And in partnership with CDC, we're working to establish a baseline and then also, significantly make reductions in those infections. We also are working to decrease the use of antipsychotic medications through the National Partnership to improve dementia care, which over the first 3 years of the program have seen a reduction from 18% all the way down to almost 15%.
Yeah, that is spectacular. I'm particularly proud of the nursing home work.
Yes.
I had an opportunity about 3 months ago to visit the South Valley Care Center. This is a nursing home in Albuquerque, New Mexico. And they were previously rated as a 1-star nursing home, and they're now a 5-star nursing home. And they got to that 5-star status in part because Health Insight, our QIO, was assisting them in improving the quality of care that they deliver for the patients in that nursing home. It was a joy to see it. And I'll just say, this nursing home is in a very poor neighborhood. It serves a very vulnerable population. It's not a brand new or fancy physical plant, but the caring in that nursing home and the quality of care that's being delivered there was really, truly extraordinary.
So we're really excited about the work of the BFCC-QIOS this year. We've reached over 99% timeliness with both quality of care and appeal reviews, which is great. We also launched the PFE work, Patient and Family Engagement work this year, another great addition to the BFCC-QIOS work. We also are have been working this year to help the areas of the United States and their territories that were impacted by the hurricane. So great work all around with the BFCC-QIOS.
We've learned that when we bring patients into the work of the QIO program, that they serve as catalysts for the energy that you often need to break through institutional barriers and to cause real change. Patient involvement in the work that we've done to improve hospital patient safety has been phenomenal. If you're the parent of a child who was injured in a hospital, you bring a certain urgency to the work of improving safety in that hospital. And so I think the inclusion of patients has been a phenomenal asset to the program. I'm especially proud that we've grown a new body of work in partnership with the Indian Health Service. The quality improvement organizations are now teamed aggressively with the Indian Health Service to support more than 20 IHS hospitals across the United States in their work to improve the quality of care, the safety of the care that's being provided for the American Indian and Alaska Native population. This is new work for us. We've invested in it substantially, and we are really pleased to now be active partners with the Indian Health Service and their hospitals.
We also are uniquely poised as the QIO program to rise to the challenge and to create small tests to determine whether or not the methodologies that we've implemented are right for scale and spread. So we've rolled out and implemented special innovation projects in areas that are key to the United States and their healthcare system, but also to the CMS administration. So we're working actively on special innovation projects in the area of behavioral health and to combat different parts of the opioid crisis.
Yeah, and we need to invest in that
Absolutely.
work. More than 90 Americans die every single day as a result of the opioid epidemic, and we believe the QIO program can do a lot to help to address and curb that crisis. I'm also very proud of work that we're doing in partnership with Hospital Improvement and Innovation Networks, which now serve as a support to the QIO program. These are 16 organizations, very influential, very connected organizations that are supporting more than 4,000 hospitals. That's 4,000 of the nation's 5,000 hospitals are actively teamed with us in this work to improve patient safety in those hospitals and to reduce unnecessary readmissions. Some of our Hospital Improvement and Innovation Network partners include the American Hospital Association, the Dignity Health Hospital System, the Carolinas Hospital System, the Minnesota Hospital Association, and others.
Now we're 3 years into our current scope of work, and we're preparing for the future. So as we do that, we've done a series of listening sessions and other activities to collect and gather input from valuable stakeholders like you about what we should work on in the future. So we rolled out an RFI this year, request for information, and have gathered feedback, which we're so excited aligns with not only the priorities of CMS and the goals that we aim to set as an agency, but also the work that we want to do in the future. So
Yeah.
great alignment there.
Yeah. One of the principles that we actively work to adhere to here at CMS in our work with the QIO program is an unrelenting focus on bottom line results that are meaningful to the American people and to the providers and the patients that we serve in the QIO program. I learned years ago from a Rear Admiral in the U.S. Public Health Service that the main thing is to keep the main thing the main thing. And for the QIO program, the main thing is generating results that matter. Now, a second principle that is, I think, increasingly important in our work today, I would sum up in 2 words: help providers. There is tremendous change that's occurring in the American healthcare system. We're shifting from a system where we pay fee-for-service from that to a system where we're seeking to pay for value, where we're actually paying for healthcare outcomes. And there are a lot of challenges and a lot of complexities associated with that. And provider organizations are facing those challenges. And it is absolutely critical that the QIO programs step up and support those providers, help those providers in dealing with those complexities. I am pleased and happy with how that's occurring, but I think it's a really, really important job as we head into the future.
Now, one of the best ways to achieve outstanding results is to set bold goals and aims. And so when you do that, you spend a lot of time in what we call being in the red. So you haven't reached your goal, but you're on your way, right? And you're working towards it.
Hopefully. Yeah.
Yes. So we strive to get comfortable in that space, and that's what we call being comfortable in the red. So you have to be comfortable working towards your goal and constantly pushing to get to goal, because it does take a lot of work to reach a bold goal. And so we strive to always get to green, but we have to be comfortable in that zone where we're still working to achieve that goal.
I think an additional principle that's particularly important to us is focusing on the outcomes while maintaining extreme flexibility, I would say maximum flexibility on how those outcomes are achieved. This is a key priority of the new CMS administrator, Seema Verma. Seema Verma wants us at CMS to be accountable for outcomes, to hold our contractors and our partners accountable for outcomes, but at the same time to usher in a new era of state and local flexibility. And so that's what we're seeking to do. We're seeking to do that as part of our implementation of the QIO 11 scope of work, and we're seeking to do that as we plan for the future. We want to be focused and tight on the outcomes while at the same time providing maximum flexibility on how those outcomes are achieved.
So one of the things that I'm really excited about with the QIO program is the opportunity that we have to put patients at the center of everything we do. We meet with QIOs, partners, stakeholders, and we try as best we can to make sure that all of those conversations include at least one patient to keep us grounded in the reason why we're doing this work. Our new administration has asked that we put patients first, and a lot of what we do is really centered around putting the patient before the paperwork. We want to make sure that we're helping providers reduce burden, but we also want to make sure that we're keeping the patient as the focus of the reason why we're doing this very important work.
In addition to putting patients first, there are other elements of the administrator's agenda that I'm particularly excited about. Addressing the opioid crisis, reducing burden for the providers that we serve, providing greater flexibility to state and local governments. These are all high priorities of the current CMS administrator. We're already actively working in these areas and intend to do a lot more. I'm also very excited at our increased use of transparency across the entire QIO program. We freely share the results, whether we're in the red or we're in the green or we're in the yellow. We share results for individual QIOs that are in the red, that are in the green, and in the yellow. And that sharing, that transparency, where we can see who is progressing and who is not progressing, helps all of us to get better. It shows us where to look for the results, and it shows us that it's possible to achieve the results that we're after and who to consult with about how we can improve our methods. When we get the folks who are in the red talking to the folks that are in the green, that's when you really start to see some magic happen. And the other thing about that is that it's not always the same folks that are in the green. You might be in the green on one thing and in the red on another. And I think that transparency in our system is really helping all of us to get better quicker. And I am really excited about getting better quicker as a community practice. I think it is an extraordinary way to work and an extraordinary way to live our lives. So in closing, I want to say thank you. Thank you for the hard work. Thank you for the persistence. Thank you for the innovation. We are delighted to be in team with all of the partners and stakeholders that make the QIO program a true results generator.
We appreciate your commitment to all of the bold aims and goals that we work together to set. We want to thank you for your commitment to teaming with us. We really appreciate it.
Good going.